Hello, welcome back to another episode of Red Pill versus Blue Pill. I hope you guys are doing well and had an amazing weekend. I am Dr. Delon Canterbury. I'm one of the CEOs and founders of Geriatrics, and we are going to be discussing the significance of leveraging your very own pharmacist who at least can help you with saving you time and money, but also advocating for patients through deprescribing. So, this is a part of our live video series where we share some tips that senior care providers can use and can incorporate today in their current practice. So, really honored to be here. I'm so pumped to see where this accelerator is going to take you and your practice and other senior clinicians alike. I really created this program, this Deprescribing Accelerator, out of seeing how many people in the senior care space truly have no idea how to leverage their pharmacist or really how to be that advocate when it comes to stopping harmful medication use in seniors. And so the common sentiment I find in this space are people are just feeling lost, frustrated. They feel like it's not their responsibility. They feel that it's a waste of time. There isn't a need to talk about this, but we've been discussing, particularly in how, some people want to choose the blue pill. And if you want to maintain the status quo, then our deprescribing accelerator is not for you. We want people who are going to be pioneers, patient advocates, and will go the extra mile to make sure their patients know and their providers know if they may be on or spotting a harmful medication regimen. And so our seniors, unfortunately, are some of the most vulnerable populations when it comes to people being overprescribed. Not only does the adherence drop, but also the fact is they are just more susceptible to harm. So why aren't we using every person who's a healthcare provider or touch point to be that continued advocate and to know how to advocate? And then herein comes your very own geriatric pharmacist. But I want you to just see that it's more than just having a pharmacist. You can literally start advocating for deprescribing today, now, not tomorrow, not waiting for permission. You can start doing it now. And this is what I've learned and seen in working in these nursing homes and presenting to caregiver groups and just letting you know that the need is there, but people don't know what to do. And unfortunately, with COVID still blowing up on the rise, our providers are grossly overwhelmed and have more on their task list to accomplish. So, why not be that helping hand to show that we're working as a team and make their lives a little bit easier if you see potential harm in your patient's medication regimen? And so, the doctors and providers who write these scripts, they need pharmacists and they need support. They want to know if their patients are having issues with the regimens they're on. We shouldn't be afraid to speak up if we see someone in harm's way or if we see someone suffering from side effects or just conditions getting worse. So again, this program is intended to give senior care providers, people who touch seniors, whether they are nurses, pharmacists, consultant pharmacists, independent pharmacists who do their own type of contract work, again, gerontologists, therapists, social workers, people who live in wellness communities and retirement communities, people who are caregiver advocates who run caregiver training programs, essentially people who are pioneers and want to literally start leveraging the skill set of deprescribing and putting this into their current practice. And it could be a value added benefit, or it can also be a potential service you provide that you can charge for whatever price you may want. So again, this program was developed to teach people how to spot and stop harmful medication use in people over 60. This is intended truly to help those who may not be comfortable with some of the medications and syndromes to look out for when it comes to the senior care space. But additionally, we want people who want the best out of their patients' health and well-being. So I know a lot of our healthcare professionals want that, but they often don't know where to start when it comes to the medication. So this is a crash course that'll teach you the skills, the tools, and what you can use in your power today as a caregiver advocate or as a clinician to truly put deprescribing to full use. This is not for patients. This program, this Deprescribing Accelerator, is not intended for the patient demographic. It's also not intended for caregivers. It's truly intended for caregiver advocates and caregiver trainers. This is not intended for people who want to choose the blue pill. If you want to maintain the status quo, if you want to just not go the extra mile for your patients, or you don't see a value, then my friend, this is not for you. This is for people who constantly see people over medicated and they want to know how to put that power of advocacy mixed with some clinical to get the best results for their patient. This, again, isn't meant for those who don't want to advocate. And this is not going to be a quick and easy fix that's going to solve all your senior care org's business needs, okay? This is specifically for forward thinking and really seeing healthcare as a proactive tool to advocate for everyone's well-being instead of being reactive and waiting for the car crash to happen. So what does our program looks like? What happens when people join? So this is a 12-week Deprescribing Accelerator. We're going to have 10 weekly live trainings for about 2 hours. And what we'll do is we'll go over in nitty-gritty detail the passage of deprescribing, the history, what that entails, what that looks like, what are some of the common barriers that are faced, and then we walk through the entire syndrome and how to look at side effects, how to look at what meds are problematic, how to know which health conditions in the senior space may be more of a red flag than others when it comes to advocating for deprescribing. We talk about using genetic testing, so how to leverage your pharmacist or nurse practitioner to use genetic testing as a value-added revenue stream that may have limitless potential. We then go further into real-world clinical tools, and that's literally software, hardware, toolkits, whatever you need to literally make your life easy to be that deprescribing advocate. That's what we're going to combine into our ongoing accelerator. So you'll have downloadables, you'll have links to software programs that can help identify some harmful meds. But also you'll have a community of dope pioneers who see the value in leveraging pharmacists and see the value of learning how to look at this as a holistic healthcare problem and not as just another one-off that a patient has to just deal with on their own. So again, tremendous value in learning what the expertise I've had in geriatric pharmacy and how you can put this in an easy to follow, simple step-by-step process so you can start implementing for deprescribing today. You'll also have tons of amazing content. So not only will you have 10 lectures that are a part of our program, but you'll be able to repurpose those lectures as a free courtesy for this new cohort. You're going to have access to these modules and you can repurpose them for your content and with your branded name on it, so you can use them as just another template for another webinar. So again, the goal is to empower senior care providers and how they can leverage this into a potential revenue stream, but more importantly, to stop the need and use of harmful meds in seniors. Furthermore, you'll also have a patented geriatrics toolkit. So you'll have our very own secret sauce that's wrapped up into a beautiful toolkit that you can put into practice today. Literally within our first and second modules, you'll be able to start putting these into practice. We will also provide bi-weekly Q&A forums. So our community of deprescribing advocates will be able to meet with us as a group every other week for set office hours. So you can ask your questions, you can ask your concerns, you can basically approach any patient cases or any barriers or wins that are coming up for you as you are a part of our cohort. So we not only will provide you with the Q&A every other week, but you'll also get 2 VIP hours with yours truly, where you can pick my brain on setting up shop, or talking about implementation, or talking about potential deprescribing strategies and cases that you can use to inform your staff, inform your team, and empower them, particularly through helping their patients. Who doesn't want that, right? Because I want you all to improve your patient satisfaction and improve your patient buy-in and trust as a part of this process with our Deprescribing Accelerator. So you get bi-weekly office hours with yours truly. You get 2 hours of one-on-one VIP discussion with, again, myself. The Q&A is open to our entire group, so you'll be a part of our Deprescribing army, and there'll be more cohorts to come. So we're going to keep growing and expanding as it continues, as we progress and as we change lives. Okay, so you'll not only get access to 10 integral, amazing PowerPoints that walk you through over-the-counter products, herbal products, how to advocate for patients in this space, how to implement deprescribing. We look at case studies, so we'll have a couple case presentations embedded into our courses as well. These are some of the cases that I've had in my course of time in starting geriatrics, as well as what I have seen in the community setting. So it'll be a combination of courses, of cases that will delineate the impact of what deprescribing can do for you and your patients. So bi-weekly office hours, you'll be a part of our secure membership portal. So you'll have access to our course and to the recordings pretty much within a day or two of them being done. And you'll have access to the recordings and lectures and classes for 6 months after you finish the course. So it'll be 3 months for the entire course. And then you'll have 6 months to reference and reuse and relearn some of the materials as well as a part of our cohort. So you're going to have the bang for your buck for about 9 months. You're going to have access to not only 10 amazing lectures, but you'll also have access to me. So you and I will have 2 hours of VIP training. We'll have bi-weekly Q&A. We'll have case presentations, as well as the added benefit of being a part of a movement, of an army of deep prescribers. Lastly, those who complete our course will get a certificate of completion. So you will be dubbed hereby by the power vested in me as a deprescribing advocate. And so you'll be able to use this as a way to market and leverage more of your services because of this certification and being a part of our family of deprescribers. So we talked about not only the cases, but the 10 live trainings, but you'll have access to the recordings, you'll have access to your membership group, you'll also have access to our Facebook portal. So we will have a social media portal for all of our members to meet and greet and share ideas so we can consistently stay in the loop and support each other, as well as share our wins, share any feedback, and share any lessons or questions that we may have along the way. So what is the timeline? What are the details? What else do we need to know about this program? So this program is going to be a one-on-one coaching environment with a hybrid of some group elements, okay? So the Facebook group, the membership portal, the bi-weekly Q&As, those will all be group oriented. Of course, we will all be able to meet each other, but we will also have one-on-one trainings for this first iteration. So you and I, if you choose to join, we will meet bi-weekly one-on-one ourselves. So we'll get the full customized personal experience of yours truly. And usually our live trainings will last for about an hour and a half to 2 hours per week. So it'll take about 2 to 3 hours per week of your time commitment. The 2 hours for the live training like right now, and then about 30 minutes to an hour for the self-paced learning modules that will complement each week. So each week you'll have a dripped out information and self-paced learning to help you get a little more comfortable with the entire scope of what we're going to be mastering and approaching in our Deprescribing course. So yeah, we talked about that. We talked about this course structure. There'll be live trainings. So the deadline is January 15th. So January 15th is only about 2 weeks away, okay? Our first cohort will start and launch on February 5th. So we're looking at Saturday, February 5th, but it'll be one-on-one training. So basically you and I will meet and we will discuss times that work best for you so we can give you a little more flexibility when it comes to that time frame. The total investment for the coach for this Deprescribing Accelerating program is $6,500. Now, there's a $1,000 down payment to reserve your seat, and then the remainder of $5,500 will be paid with 4 monthly payments afterwards as you're in the program. So it comes out to really be about $1,375 for the 4 payments after your initial saving your seat deposit of $1,000. So again, the total for the course program is $6,500, but it is well worth the bang that you're going to get from understanding how to deprescribe from a senior care lens and understanding how to leverage this power when it comes to working with other senior organizations, or even better yet, local health clinics and local health networks that are in need of a collaboration from your organization or your caregiver support group. So we have tons of content we will cover, but again, we do start February 5th. So February 5th is our first day. The deadline is fast approaching. January 15th is the deadline. We are capping our program at 12 people, one-on-one. And we've already got a few coming on board, so seats are filling up fast. So take the time to review our course, and if you are interested, definitely comment below. I will reach out to you directly and give you some more next steps about our program. So if there are no questions, or if there are, leave a comment, ask your questions. I want to know what you're thinking, what you see might be of value to you. How do you think this can help you? I want to know your thoughts. But of course, I want you to choose the red pill. Let's not be another status quo. Let's not pass the buck when it comes to our seniors' care. Let's work together and literally change this healthcare system by being proactive instead of reactive. So again, this is Dr. Delon Canterbury, tuning in again from Geriatrics. You guys be well, much love, and I will see you tomorrow for another amazing part of our series. All right, have a great one, y'all.